you've submitted your report, CureID moderators will be alerted and will review it to ensure it meets the guidelines and that no personally identifiable information has been accidentally included. If it passes the review, they will then approve it, which makes it public. You will be able to see it in Explore under infectious diseases and the case reports for the particular infection you selected, along with all those cases submitted by other patients, care partners, and healthcare providers. If you want to dig into the data, click Explore to see all the cases that have been entered into CureID. Select infectious diseases from the list of therapeutic areas by selecting the Explore Diseases button for that section. Then select the disease card for the disease of interest to see all the information in CureID about this condition. This page lists the total number of cases that have been approved in CureID for that disease. To view these cases, select Case Reports from the tiles. You can now see the top 10 drugs that have been reported most frequently across all cases for this condition. You can use the menu on the left to filter the cases to see just those that are of interest to you, for example, by selecting a specific symptom and drug or choosing a particular outcome. The cases displayed will filter based on the criteria you selected. You can clear the filters by clicking the Reset button from the filter menu. Next, click on the individual case cards to see the full details of the report. This shows you all the information that was entered by the patient, care partner, or healthcare provider who entered the case. Cases submitted by patients and care partners are automatically anonymized. Healthcare providers have the option to have their name shown as the author of the case, or they can anonymize a submitted report if they prefer to do so. Now that you have seen all of the cases aggregated together, as well as the detailed information collected through the infectious disease form, I hope you can see the value of CureID and the power of each person sharing their treatment experience on the platform. Your experience may help a patient or clinician who is struggling to find effective treatments or prevent them from trying something that may be ineffective or cause them harm. In turn, the data collected from others may help you. We believe that collecting this information in the same way from everyone and making it openly available to the community will help identify treatments for infectious diseases that look promising and should be studied in randomized controlled trials where possible. In addition, it may identify treatments that do not seem to benefit patients and shouldn't continue to be tried. Sharing your treatment experience on CureID brings us one step closer to identifying treatments to help patients suffering from infectious diseases. So thank you for sharing your treatment experience and being a part of the CureID community.